Hey, hey, Dr. Khadijah, can you hear me?
Hey, Dr. Diedrich. Yep.
Hey, and
Hopefully,
welcome.
everyone can hear us.
Yes, I think I can hear you good. So thank you very much, everybody, for joining in. We're going to see who chimes in. We are here with another episode of Perspectives in Primary Care, and tonight is about uterine fibroids. Who'd have thought we would do such a great episode about this uterine fibroids? Okay, so it's a very interesting topic, and you may have heard of it, but might not quite be sure of what it is. So let's give a couple of seconds to see who hops on in. Hey, how's it going for you in Houston?
It is. It's hot. It's super hot, but it's beautiful. It looks beautiful. It's just super hot. However, our mayor was on the news with Wolf Blitzer yesterday, discussing how we had so many new cases, and I think we had 200.
Hmm?
Uh, yeah, maybe 200 deaths in the state. So
Wow.
he was discussing, what's going on with Mr. Blitzer and saying we need to join together and wear these masks, wash our hands, sanitize, and socially distance. And um, yeah, that's just something that we really have to do for the sake of our freedom. We're talking about people not wearing masks as a freedom issue, but while you don't wear the mask, we're banned from the Bahamas. We can't go to Europe. We can't travel.
Hmm.
So
Yeah.
that's that's where I am. How
Yeah.
about you, Pecos?
So I mean, we're doing okay. Our cases are, definitely increasing, but we're all wearing our masks and hopefully applying the recommendations. For the most part, when I'm out and about now, whereas I didn't really see it too much before, I do see more people wearing masks. There's a few stragglers out there who aren't doing it, but
Always.
yeah. Okay. So let's see. We're gonna just go ahead and just get started, okay? And people will chime in or watch the replay.
And we have to also let you know that Dr. Carol is out on in the field
Yeah.
tonight. So
And me and Dr. Kadisha gonna hold down the fort and do her proud, okay? So, and Dr. Carol says hi, everybody. Okay, so we're talking about uterine fibroids, and I'm not sure if y'all know this or not, but July is actually Uterine Fibroid Awareness Month. And tonight we're going to go over some stats, what the normal anatomy is, as well as what are fat fibroids, uterine fibroids. We're going to talk about the types of them, but we're not going to get too technical. It'll just be real, just what it is, basic symptoms, diagnosis, treatment, just kind of all that stuff. Just a nice general overview. And just please keep in mind though that even though we're both great doctors, board certified doctors, we're not here to individually treat y'all. We're just here to educate, give the information, and to share with y'all what we know, and it's for educational purposes only. And as far as me, my information it's actually coming from medline.gov, Helpline, and then the National Institutes of Health. So I'm just going to go ahead and get started. And people will come in when they can come in, and we'll appreciate any comments or questions, and we'll keep it moving. All right. So, like I said before, July is actually Uterine Fibroid Awareness Month, and being aware in general means you're educating yourself, you're knowing more, especially you ladies out there, because with the uterus, so you need to know what's going on with your body, or if you should ever get that type of diagnosis, you'll have some inkling of what it means. Okay, so a couple of stats to quote is about 80% of all women will actually develop a uterine fibroids by the age of 50, and that number actually increases in African American women, and they're actually 3 times as more likely to be negatively affected by them. For many African American women, we might have larger fibroids with heavier bleeding, and they can actually come about at a younger age. I think you were talking, Dr. Kadisha, like even like in the 30s, they can start to pop up. Um, So before I get more into it, I'm actually going to talk about the normal anatomy. So I'm gonna just show a picture, and you all be able to see this. And let me know, Dr. Kadisha, if you can see this, okay? Um, so I'm just gonna have to apologize in advance for the technical difficulties, but this is just what we can get y'all to understand. So you're gonna actually see the uterus. You can actually just kind of read it. You have the two ovaries. You have the uterus, which is a large muscular structure right there. Then you have the cervix, and then the vagina. So the uterus is where these fibroids happen. But what are fibroids, right? They're actually abnormal growths that can develop in the woman or on the woman's uterus. Okay, and they're kind of like called tumors. These tumors can actually get quite large. They can actually cause pain, heavy periods, and in a lot of cases, a woman might not even know she has one because they're not causing any problems. They might just be found out when they're looking for something else on other studies that Dr. Kadisha will talk about. These growths are actually usually benign or non-cancerous, and actually the cause of them are kind of unknown. Okay, there's different factors, and I'll talk about them a little bit later. You may hear of the term not only uterine fibroids, but you might hear of the term myoma, leiomyoma, uterine myoma, or fibromas. So those are similar names, okay, if you hear those talked about, or if your doctor tells you about that. Well, what causes them, right? Like I said, we're not quite sure of what the exact causes are, but evidence does show that there are multiple factors that play a role. So genetics, hormones like your estrogen and progesterone, growth hormones, major stressors, all right? And all of these things interacting with each other can possibly set you up for developing these fibroids, all right? So let me just say, just to go a little bit deeper, these actual tumors are like smooth muscle cells, okay? And they're just the walls of the whole uterus is a big muscle, okay? And so these growths just grow, and they, depending on where they grow, they're labeled as to where they are located. And so there's a few types, and I'll just briefly state them. Please don't remember them. Just if you hear them, you'll be like, okay, Dr. Dietrich said this is this, but you don't have to worry about it. So here's another picture. I'm just going to show it, and then you guys can just see that they're located in different areas. So there's that submucosal, and they're just underneath the uterine lining. Intramural, which actually grows between the muscles of the uterus. Subserosal, they on the outside, and then some have little pedicles. So you can see that little blip right there. Those are more like what's called pedunculated. Okay. Risk factors. So we all want to know, are we at risk for developing uterine fibroids? And some risk factors for having these fibroids are like at your age. Sometimes older women are at higher risk than younger women, but it can, of course, can happen in younger women. Being African American, being obese or overweight, if there's actually a family history, having hypertension, no history of being pregnant at all. Actually, I was surprised about this one too, having a vitamin D deficiency. Um, Soybean milk, using soybean milk, and I was surprised at that one too. And I'm having to think that it's probably having to do with like being estrogenic or playing with the hormones. All right. And actually, risk factors that actually lower your risk of uterine fibroids are long term use or oral injectable contraceptives and actually being pregnant. All right. So those are just some nice tidbits for y'all to understand. And Dr. Kadisha is going to be talking more about like the symptoms. Like if you go into the ER or whatnot, you got this lower pelvic pain, and y'all end up doing an ultrasound, and something happens. So Dr. Kadisha, just go ahead and talk to us about what are some of the symptoms, and how a person is diagnosed and how they're treated.
Okay, everybody. So while Dr. Dietrich said, many women never know they have fibroids because they don't have
Right.
any symptoms. What symptoms drive a woman to go to the ER? And so, what have I seen? So,
Pain.
what? Yeah, exactly. Pelvic pain, low back pain, excessive bleeding, like especially bleeding for a week. So bleeding longer than usual, bleeding heavier than usual, especially if you're passing clots, like if clots are
Yes.
coming out, that typically means more rapid bleeding, right, Dr. Dietrich?
Yes. And heavy bleeding. Yep.
And then, or you might have heavy bleeding that's between your periods. So,
Yes.
uh, yeah, so it could be anything. So, while people might not have symptoms, fibroids are tricky in that they can present in a number of ways. They can present with increased urination, they could present with constipation, or just like a pressure, fullness, swelling, or increased size in the lower abdomen. And believe it or not, some people come to the ER just because they feel bloated or just because their lower abdomen seems a little larger than usual. Or some people, and it's, people come to the ER for, and it could be also a painful intercourse, even like trouble conceiving. People come if they fear that they're having a miscarriage, things like that, and we find out incidentally that they have fibroids. But so the first thing we do is after we get the history, and we usually find that the person is, like Dr. Dietrich says, at least 30 years old. They might be overweight, uh, often African American. They may or may not be pregnant. And then we move on to the exam. We do a pelvic exam to check the source of bleeding, because it could be other things or other things that we have to consider. It could be like a cervical polyp or a tear, infection, things like that. And then also we have to ultimately feel the uterus during the bimanual exam, bimanual meaning two hands, because we're using one hand that has fingers in the vaginal canal and then the other hand on the outside, just feeling the shape. And we might feel like a bulky, enlarged uterus. We might have already gotten some results back on the lab work that I'll discuss. We might already know that the urine pregnancy test is negative, but their uterus feels like that of a pregnant woman.
Right.
So that's what we're expecting to feel on an exam with on a woman with fibroids, and they might be surprised at how tender they are when we press on certain parts of the uterus. So after that, then we'll check blood work. Again, we'll check the pregnancy test. Especially if she has pain and bleeding, we want to make sure that there's no ectopic pregnancy going on. We're going to check a ProTime and INR. ProTime and INR testing looks at how fast you stop bleeding, how fast the blood will start to clot up, rather. So we want to make sure you don't have like a bleeding disorder that's causing you to bleed abnormally. We also want to check a complete blood cell count to see if you are anemic. Sometimes that might be the only sign that a woman has fibroids, this unexplained anemia.
Mm-hmm.
And then we also want to check your platelet levels too, another indicator of how fast or how easy it is for you to stop bleeding. So that's all the blood work. Then the next thing may be imaging.
Right.
And I'll warn you ahead of time, if you are not anemic and you're not pregnant, some more conservative ER doctors might not get the ultrasound,
Mm-hmm.
especially if it's really big. We know you're stable. Yes, you are bleeding. It may be abnormal, but we've done the pelvic exam. We just see like a low to moderate level of bleeding, and you might not get that ultrasound that you came looking for, unfortunately. However, typically, if we can, we will get the ultrasound to see the size and shape of your uterus. In addition to the rest of your reproductive system, we're looking for ovarian cysts, ovarian abscesses,
Mm-hmm.
signs of ovarian torsion, which is equivalent to a man's testicular torsion, where that ovary is twisted on its blood supply. Uh, and we're also looking to see if you have fibroids, as well as, and then, then ruling out an ectopic pregnancy if you are pregnant. And then sometimes you might see a cervical polyp on an ultrasound too, if it's large enough. So it is interesting to tell a woman she has fibroids and she didn't know she had it. But then we have to go back to the symptoms. It's like, okay, well, you said you had this bloated feeling. You are or are not bleeding. You're constipated, or you're having increased urination, but the urine is clean. If we rule out all these other things and we see fibroids on the ultrasound, that's likely the cause of it, even though you didn't expect it.
Right.
So if you are not terribly anemic, if you don't need a blood transfusion, which is one of the complications of having fibroids, if you're anemic but stable, and we can get your pain under control, then we will discharge you. We'll typically discharge you for pain control. We typically like to advise Motrin and or Tylenol. You can combine them for an increased effect without being made drowsy or anything. And definitely refer you to an OBGYN because they are the ones who will ultimately provide the treatment.
Right.
Okay, so typically when you go to any specialist, they're going to repeat whatever was done in the ER. So if we did an ultrasound, the first thing they're going to do is their own ultrasound, and just to make sure. And if they need more information, or especially if you're fibroids, and the treatment and everything and prognosis and all of that, it all depends on the size, the number, and location of the fibroid. So just remember that take-home message: size, location, and type, size, location, and number of the fibroids. That determines everything, as well as your stability as far as your blood levels and things like that. So if they feel that you need treatment, if the fibroids are, causing heavy bleeding, you're significantly anemic, things like that, then they may go on to have a pelvic MRI done for more in-depth pictures of your uterus, ovaries, and other pelvic organs. And again, onto the treatment. Treatment's the next thing. Again, it's based on the size, location, number, but also your age, your overall health, and your expectations of having a child. So your desire to maintain fertility, if that is still an option. Okay, so treatment options, and we'll talk about traditional treatment options, and then we'll talk about the more natural treatments, which are really important, especially if you're waiting to have surgical treatment, because there are things that we can do for ourselves while we wait for surgery. So the traditional treatment options include like a myomectomy, which is surgical removal of only the fibroids. The most aggressive treatment is a full hysterectomy, meaning removal of the uterus itself. But there are also multiple newer, less invasive treatment options available for fibroids, including one is a UFE, which stands for a uterine fibroid embolization, in which small particles are injected into the uterus to cut off the blood supply. It just wants to, embolization means to cut off the blood supply to the fibroids so that they will hopefully shrink and die. So
that makes sense. So if they're not getting fed by blood, they're not going to grow. So
exactly. Exactly. So another procedure is the MRI guided FUS, which is the forced ultrasound surgery. And yeah, I know these treatments are going to sound very aggressive towards the uterus, but it's just the names of the treatments. But During the MRI guided forced ultrasound surgery, the person does lie down in an MRI machine so that the lining of the uterus is visualized, so that you can see it, so that doctors can um, instill high energy, high frequency sound waves directed at the fibroids to destroy them. Other
Wow.
things that, yeah, that can be done are again, like laparoscopic surgery to remove the fibroids or the uterus itself, and that's when they have the instruments with the rods, so that you might have like a few small incisions versus that long, low transverse incision that you might see in older people. Then there's the hysteroscopic surgery, where again, scopic means like they're looking at the uterus inside and out and removing the fibroids as they see them. They're even doing robotic surgery to remove the fibroids. Another term that you might hear is called myolysis. Myo, again, it's like Dr. Dietrich said, it's a myoma. So it's lysis is like a breaking up of these fibroids. And it's again where heat sources like lasers or an electric current will shrink fibroids. On the other end is cryomyolysis. Cryo meaning like freezing. Myo is the fibroid. Lysis is kind of like destroying or breaking it up. Again, where they're freezing the fibroids. Another procedure is the endometrial ablation. The endometrium is the lining of the uterus. Ablation is destruction. Again, an instrument is inserted into the uterus to destroy the lining of the uterus and any fibroids therein. Now, no single treatment option is best for every fibroid patient. Determining the best treatment option for any given patient should take into account those multiple factors that I mentioned before, like the size, number, and location of the fibroids, the particular blood supply to the fibroids, the patient's age, desire for future fertility, and other medical problems, if any. And lastly, like I was saying, sometimes you might not be able to have that surgery for weeks or, maybe even over a month. So what can you do for yourself in the meantime? So some more natural things that folks like to do, because I know people do like to exercise their more natural options and not go for those invasive procedures, is one thing you can do is limit your exposure to external estrogens.
Right.
And one source of estrogen is actually our body fat. Our body fat holds estrogen in it. So one thing we can do is lower our level of body fat. And with exercise, a low fat diet, preferably.
It all goes back down to diet and exercise, right?
Yeah,
For everything.
from corona to fibroids.
Everything.
Diet
Yeah.
and exercise, because we are what we eat. So that diet, they recommend limiting meat and dairy, especially those high in hormones. And you want a diet that's rich in the cruciferous vegetables like broccoli, cabbage, kale, cauliflower, and Brussels sprouts. And I know that soy has been praised and persecuted as far as the reproductive system. But if you could avoid processed soy products, that would be a good way to limit your exposure to external estrogen. Another thing is to support your liver. Believe it or not, the liver is amazing, and one of its jobs is to break down estrogens. And you can make it more able to do so by reducing your intake of things that it has to focus on, like caffeine, alcohol, things like that. Okay. And so, and then other things that you can do are even looking at your emotional state. Okay. And we have a psychiatrist in here also. Yeah, hi, Dr. Ken, Dr. Mashika, Jera. Yeah, hi, Mom. Hi, Victoria. Thanks for coming in. So other things you can do are exploring your emotions, anger, harboring negativity, resentment, things like that. That can
Stress.
also,
Yep.
stress. And yeah, and Dr. Diedrich is America's relaxation doctor. I know you have some, you can help people out with that
I
for
just wanted
sure.
to chime in, like diet and exercise affects
Yeah.
everything. Stress affects everything as well. So stress just makes everything that much more worse. So definitely getting a hold of your stressors, utilizing different relaxation techniques helps your overall health. In addition to with the fibroid, everything. So diet, exercise, and stress control. Period.
Yes, indeed. And so acupuncture has been, some folks in the natural community will say that acupuncture has been shown to shrink fibroids.
Um,
Yoga also helps just with flexibility, and anything that increases blood flow to the pelvis will help relieve the pelvic pain due to fibroids, as well as massage, because sometimes that pain can cause our muscles to tense up as we try to hold ourselves a certain way because of the pain. Um, so, massage, yoga, acupuncture are things that may help while you are awaiting surgery. And I know Dr. Carol, the meditation master leader of the Meditation Nation, would also advise meditation for relaxation, like Dr. Dietrich
right.
says, to release stress and just to have the body, better able to deal with what's going on in general. So,
Excellent. Excellent. Very good.
so guys, yeah, let's see, any questions? Because someone had mentioned earlier that they had, let me see if I can scroll up in the comments. They had talked about a nightmare. So Juanita Douglas said
That's my
that,
cousin.
okay. Hi, cousin Juanita. So she have some horror stories about uterine fibroids over the years. I'm glad you're sharing this information with people because I had to go to 3 doctors over a 5-year period
Oh,
before I got them under control. And I don't know if she's still here, but if she could let us know of some of the things that might cause a delay in diagnosis or treatment. That would be really good to know. And things like that do happen. Your fibroids can shrink or grow with time. So that's one thing. So you, especially if you wait a fair amount of time between evaluations, they might change size, and based on what the doctor sees on that particular day,
all right.
they may become conservative or aggressive with their treatment. And then you go on, oh great, she's back. Okay, so she says, yes, I had the uterine fibroid embolization as the final surgery, and she also had a laparoscopy.
Well, I hope you're doing good now. Yes. So
And
I'm glad. Uh-huh.
and just to know, even though we have a bunch of these treatment options, even if you have the most definitive treatments done, do know that your fibroids could come back over the next few years. They can grow back. So she says, I think being a Black woman, I was ignored until I started bleeding through my clothes at work. And
That's one of the unfortunate truths for sure. For
mhm,
sure.
that goes
Yeah, I
to
just wanted to say too. Some people may wondering like you were kind of saying before about shrinking, but uh, a lot of the times as a woman gets older and like goes through menopause, fibroids can shrink. It's not true for every woman, but don't forget because that estrogen isn't there. That estrogen is decreasing, so sometimes those fibroids may shrink. And again, I wanted to make sure people understand that just because you have fibroids and with the oma at the end, leoma, myoma, it doesn't mean that it's cancerous. Okay, and it's very, very rare that fibroids can turn into cancer. So please keep that in mind if you're diagnosed with that. You know, like what Dr. Kadisha was saying, discuss with your doctor what treatment options are best for you. And I guess technically, the only 100% definitive treatment cure rather is like a hysterectomy, is to take it all out, but that might not be the best option for you. So just become educated to know what treatment options are out there. One of the things too, a woman who's diagnosed with fibroids, they're wondering if they can still get pregnant, all right, or if they can still have children. And if that's the case, you may still be able to. So it just depends on, like Dr. Khadija was saying, the number of them, the size of them, because if they get too large, they may compete with the space for the baby. So again, getting your checkups, getting the ultrasounds, finding out how big they are, to see if you will be able to conceive, or see if you will still be able to carry the pregnancy to term. Because maybe even if you're pregnant with large fibroids, there may be something that can be done to still help you go through the pregnancy. So please keep that in mind. Just because you have fibroids doesn't necessarily mean that you can't get pregnant. All right. So I know Dr. Kadisha went off a little bit. She'll be joining right back. Um, that's a great question, Jackie. I don't know if you know this answer to Dr. Kadisha. Jackie wanted to know: is there a greater risk of developing fibroids if you have PCOS? So I think that's a great question. I know PCOS has to do with the spectrum of insulin resistance. Not all the time, but a lot of the time, a woman with PCOS is usually overweight, multiple cysts on the ovaries. And so maybe because of the extra estrogen that a woman may have, I can kind of see how that can possibly set you up for more of a risk factors for uterine fibroids, because of being more overweight and having that extra estrogen. So I don't know what your thoughts are. That's a great question, Jackie.
Yeah. Mm-hmm. And again, Dr. know more about that than me, as someone who actually delivers babies. So I wanted to ask you, Dr. Dietrich, like, what have you, if anything, how much have you seen of fibroids while doing deliveries? Can you actually see them, or?
You know what? That's a good question. Actually, no, because doing the vaginal deliveries, I haven't really, see them, because we're not seeing the uterus. So doing the vaginal deliveries, no. And then actually doing the C-sections, we actually may be able to actually appreciate some of the external fibroids there, but I haven't actually been witness to like a really large fibroid during a C-section. I haven't had that experience.
Mm-hmm.
Yeah.
Yeah, it's just a burning question that I had. Okay, well, so any more questions or comments?
I don't see any more questions. I just want to make sure that we didn't miss anyone. Just saying hi. I see Dr. Sylvia's there. So I don't know if we mentioned Dr. Sylvia or Kasali. Thank you very much for joining us. And please, if y'all have any more questions, please put them in the chat. Otherwise, we're fixing to wrap it up.
All right. And yeah, Dr. Carol, again, she sends her regards from the field.
Yes. And we miss you, Dr. Carol, until next time.
We are a little frozen here. Okay, there you're back, and you're unfrozen.
Okay, so I guess I'm gonna sign off. Dr. Dietrich. Thank y'all very much for joining us in another episode of Perspective in Primary Care with me and Dr. Kadisha. Dr. Carol will be on the next episode as well, and we thank y'all very much for your time. Of course, if you're watching this on the replay, we'd appreciate you putting #replay in the comments. To find out more about what I do, I help people with stress in the workplace learn to better manage that stress. You can pick up a copy of my #1 best-selling book. You can go to my website, drdietrichg.com, to find out more about what I do. And then also, if you're ever in a jam and you need some help, going to the ER and finding out what to do before you get to the ER, you need to talk to Dr. Kadisha. So what do you do, Dr. Kadisha?
Well, yeah, thank you, Dr. Dietrich, for that introduction. So, yeah, I'm a certified emergency medicine physician. This marks 20 years for me since I
Woo!
was an intern. Oof, yeah, I'm probably giving my age away. But so yeah, board certified emergency medicine physician, concierge physician, um, and author of a #1 best-selling book, Help Us Help You in the Emergency Room. It's #1 in emergency services because it's what an ER doctor would tell you if she only had the time, and we usually don't have the time. And the book helps you avoid unnecessary delays, expenses, miscommunications, and frustrations, and maybe even could take off an hour of your time if you just know how to prepare to speak to the ER doctor or nurse during those few minutes they may have before being pulled elsewhere. I'm also the creator of the Mobile MD Kit and the Mini Mobile MD Kit, and you can check us both out at our websites that are scrolling below. And we thank you so much for joining us. We know you had other things you could have been doing with your time.
Yes, thank
We
you for
hope
joining
that
us.
you guys will, and please share with anyone else. Think about someone, a woman in your life who has some symptoms that that seem kind of vague, but she's gone to multiple doctors and not much has been done, and the symptoms continue. Who knows? It could be fibroids.
Yes.
So
I just want to say, oh, that's a great point too. Listen to your body. If you're not getting the answers that you need, you just might have to just find somebody else because you know what your body feels like. And so if you're not getting that care, like Juanita said, she had to go to other doctors. So you just might have to do that. Okay. And thank you very much, Juanita, for your comments. And I see Rowena is joining on as well. Thank you so much. But ladies, listen to your body and take care of your body so it can take care of you, right?
okay, guys, and
All
please
right.
put in the comments any other topics you'd like us to discuss in the future. Okay, and with that, shall we say goodbye, Dr.
Yes,
Deidre?
ma'am. Yes, Doc.
Okay, you guys be safe.
Okay, see y'all. Bye.
Bye.